And now a moment from Your History and Health comes first with Dr. Richard Brown.
Hello, welcome back again to Your History and Health Comes First. This is Dr. Richard Brown, your host. Today is July 20th, 2022. And this week's podcast, I'm going to talk about something that it's an unpopular topic. 2 years ago, it was pretty popular among people because just about everyone wanted to learn as much as they could about coronavirus because the coronavirus was invading all of our lives at all kinds of levels. But 2 years later, it seems that the enthusiasm has waned. People aren't as excited about learning about it. They think they know about it now. They think that it's over or that they know what to do and they don't need to do what they say they should be doing because people have stopped wearing their masks. They're starting to have events indoors and outside that includes multiple people, and safety precautions are not being put in place. But listen very carefully. The virus is still here. It is not gone. It has mutated. It has changed the way that it can attack you and eventually kill you if you're vulnerable enough, but it is still here. And so I want to use my time today to talk about the fact that it is still here and sort of go back through the history. Sometimes we forget our history, which is part of why, this show talks about our history and our health. So right now, the total deaths in the United States since the beginning of this virus is 1,019,604. Okay, and many of you know people who are included in that number. Now, the average death that takes place now in the United States from COVID-19 and COVID-related issues is 418. Now, that's a lot of people dying on a daily basis just from that one disease. There's lots of other diseases and issues that people are dying from, but just that one invisible disease that we knew nothing about 2 years ago, that now we know a lot about, but because of people's behavior, we're still having a number of deaths that's unacceptable. So let me go back a bit and talk about the history and how we got here. And this is from a perspective in Omaha, Nebraska, which is where I'm located. So it was March 2020 when the World Health Organization declared that the volume of coronavirus infections was large enough that it became a pandemic. They labeled it a pandemic in the United States. People were getting sick. They were getting hospitalized at an alarming rate. We saw ambulances and hospitals and dead bodies all over the place, especially in some of the largest metropolitan areas. And then government finally, after lots of debate and criticisms and just dumb stuff, finally initiated a mask mandate. Businesses and schools were forced to wear masks. Production went down. Businesses lost their power, lost their businesses in some cases, had to reduce. Lots of revenue was lost. The masks became stylish, though. They were glamorous. They were glittery. A whole new industry developed as a result of people making homemade masks to protect themselves against the coronavirus. So it was a time in which this thing came along that was serious enough for us to get excited about it. And it was sexy enough to actually, take it and play with it and embrace the fact that we had to wear a mask and stay in. So a lot of creative things took place that was very, very helpful, especially for those who were trying to do the right thing. And so, but it got boring, it got tiresome after about a year. And we're now going into the third year of this condemnation, this quarantining, this awareness of the fact that there's something deadly out there that we should be worried about. But back then, scientists were feverishly looking for a vaccine to inoculate the population against this deadly virus, because there was no vaccine. And at the same time back then in 2020, there were conspiracy theorists that didn't help the situation, because they were telling people that it's not necessary, that it's not real, that you don't have to do it, that the vaccine causes this, the vaccine causes that. You'll grow hair where it's not supposed to be grown. You'll become metallic. They will insert tracking devices into your arm. All kinds of just crazy stuff took place. But it got serious enough for the federal government to create a law called the Coronavirus Relief and Economic Security Act. And in March of 2020, March 27th to be exact, they began to send about $1,200 on average to American households to help ease the pain of unemployment, food shortage, and the weakening economy that was taking place. But still, many denied the economic and the environment that the epidemic was creating for. They denied the epidemic, that it exists. And so by December 9th, 2020, America saw its highest single day of deaths due to COVID-19 at more than 3,000. So on a single day, 3,000 people on average were dying of COVID-19. And we know that it affected certain people with underlying conditions, the elderly, those with compromised immune systems. And so many didn't worry about it, but 3,000 people a day is a lot just from one virus, one disease, one organism that we cannot even see. So the Federal Drug Administration finally developed some vaccine, and shots became available in December of 2020. So from March to December, the science developed a vaccine, a very quick time frame. Turnaround was really great. Some people were upset about that. So we got a vaccine now that helps save lives, but it was too fast, and so something must be wrong with it. So the first to receive the vaccinations were hospitals, frontline healthcare workers, those who lived in long-term care facilities, and individuals that were older than 80 years of age, they got it first. So hope was born in the American environment, and there was thought that there would be an end to this worldwide nightmare. So during that time, I was doing some consulting with Creighton University, which is a major university here, one of the major universities, Catholic University. And so we were able to collaborate with Douglas County Health Department, which is the health department here, and the Center for Promoting Health and Health Equity is one of the centers that I happen to be the chairman of at Creighton University. It operates out of the Office of Health Sciences and Multicultural Affairs. Well, we had developed a relationship with the health department to just spread the word on COVID-19, just to educate the minority population about this disease. And so by this time, 6 months into the epidemic, the pandemic, we were approached and was able to get a grant to not only provide education, but to actually develop some health ambassadors to actually begin to communicate with the minority population and make sure that they understand the disease, get vaccinated, and do what needed to be done to keep everybody healthy. So our target population that we got involved with and wanted to make sure that we got the communication to was certainly the African American population, the Latinx population, which They're now using that term Latinx, although I've talked to certain Latinos, Latinas who do not like that word. So we're still working with that until we figure out the correct one to use, but recognize that I'm respectful of what people believe that they want to be called. But right now I'm using the Latinx population or the Hispanic population. Some people don't like that one either, but it was that population, the African-American population. And you know, we went through phases of what we wanted to be called as well. And we arrived at African-Americans, and still there's people who want to deviate from that. But also there were low-income people, and we found a lot of them in the housing complexes, the housing authority. And then there was the Maya community. And then, so all of them resided in the north and south part of Omaha, Nebraska. So this marked the beginning of Creighton's Center for Promoting Health and Health Equities Phase 2 response to the growing coronavirus infection rate. So at that time in Douglas County, the infection rate had risen to 64,040. The number of deaths had risen to 670. So we developed a response. We had to figure out what we were going to do about this epidemic, how we were going to fight it. So we developed a 6-month plan, which was to develop a year-long strategy with the community based upon certain media and other avenues to get the communication out about this disease. So the aim was to develop massive communication and education to inform the population about the coronavirus pandemic. So we implemented the education and information through a series of well-planned, organized, and orchestrated activities. And so we conducted training, we completed documents and did a lot of research. We created town hall meetings for the population. We participated in community events. We targeted those people who otherwise did not get targeted, those folk who may not watch cable TV or regular TV, and certainly do not watch the news channels. And we wanted to get to them. There's some people who don't have computers, and it's kind of unbelievable, but some don't even have cell phones. So we targeted some of those people to make sure we got the information to them. We focused on myths versus facts. We focused on vaccination science. We developed a pocket guide that helped to answer a lot of questions surrounding COVID-19. We developed a newsletter, which was circulated throughout the community through email, through distribution through various community organizations. We were in the churches, about 12 churches we were involved with, and about 11 of the public housing towers. We actually created original music and jingles that we placed on TV. We developed press releases. We did some, what did we do? We did some vaccination clinics and collected a lot of data. We monitored that data. We analyzed that data. We evaluated that data as well as our program. And I think we did a pretty good job of communicating that the virus was real and that its only mission was to kill, and that you did not need to hesitate, you needed to vaccinate. And we had people in the community reciting some of the slogans that we had created. And people were actively telling relatives and communicating to people on the street what they'd learned about the COVID-19 pandemic. And our ambassadors, which we had upwards of 50 people, both Hispanic and English-speaking individuals, Maya community, who we trained on the science and the education and the symptoms and the latest information about COVID-19. And their job was to communicate that information to their communities, as well as bring back feedback to us as to what responses they got when they delivered that message. So this communication network was a very strong one. And we did a lot of communication. We identified where the testing sites were. We made sure people understood that it was free. And I'm still writing newspaper articles for the local newspaper, The Star, on COVID-19 and of course on physical activity and its value. And the music is still being played at various events and various venues. So there was an 8-week training program that we took them through. I mean, 3 hours a day at each of those sessions took place where we did training. And it was mostly through Zoom, of course, because the pandemic was upon us. And there were case studies and there were lots of interaction and communication. Myth-busting communication took place. There was cultural competency that we had to take into consideration. There were ethical considerations and cases that we went through to make sure we kept the participants informed. And each of them got a certificate certifying that they had been trained in on the information and been educated on COVID-19 and how to do a presentation. So we achieved a lot of accomplishments. I mean, the publications were numerous. I think during that 6-month period, I wrote at least 11 articles in the local newspaper, initiated 300 public safety announcements on the radio and in newsletters. We created 3 billboards ads that were erected across the city. And we did numerous numbers of posters and flyers, and we did banners. The music tracks, as I mentioned, were both in English and in Spanish. So the next chapter in this COVID-19 story is starting now, because we've got a resurgence. We've got deviants. We got variants. We've got mutations. This virus has not stopped. It is moving faster than humans are moving to fight it. There's need for new vaccinations beyond what we've already created, because as it mutates, we have to develop new vaccine to attack the new mutation. The vaccines only last, we now know, for this particular disease, about 6 months. And so now we have to get boosters. Most of you have gotten a booster, or you should have gotten a booster and then a second booster. And when the third booster comes out, you should probably get that. As a matter of fact, I believe, as others believe, we're going to probably have to get a booster every 6 to 9 months for a while. And that's in addition to your flu shot every year. So we're in a war that's ongoing and is not going to end anytime soon, mostly because of the naysayers and those who are talking against the vaccine, those who are reluctant to take the safety precautions that they should take. So there's a need for continuous research, and we must respect our researchers, our doctors, our scientists, our lifelong people who have dedicated their entire lives and their career to studying bacteria and viruses and disease and helping to keep us alive, because had they not been doing that, much of the population would have died many, 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 many years ago. Much of the population who is still alive is alive because of the fast-acting scientific research that was done by these smart, intelligent, dedicated, valuable people on this planet that are developing these vaccines to fight these viruses to keep us alive. So the past 2 years saw tremendous progress in attacking this virus, but it's still here. Douglas County was, as I looked last, the cumulative amount in terms of numbers infected was about 78,000 just in Douglas County, where I live here in Nebraska. And the deaths had reached about 750 at this point. So in the United States, as I mentioned earlier, it's been about 1,019,000 that have died simply from this disease. So there are some very important issues that we must keep our minds on and think about. Number one is controlling the deadly, what we now know and what has come on the scene as a variant called the BA.5 variant. This is a variant of COVID-19. So we must control this deadly variant. Number two, we must protect our children that are 5 and under now, because we just now got a vaccine that can be used on children that are 12 and under, and even those that are 5 and under. And we must eliminate false vaccine information. And so finally, we absolutely must encourage, and we must hope and stimulate the need, not stimulate the need is there, but stimulate the infusion of additional funding from the federal government, from the state government, from county, from the private sector to fight this deadly disease until it is defeated. So the good news, which is what I'll talk about in future podcasts, is that just in June, a month ago, the CDC Director, Rochelle Walensky, endorsed the Advisory Committee on Immunization Practices, and they're recommending that all children 6 months to 5 years of age should receive the COVID-19 vaccine. Now, this expands the eligibility for vaccines to nearly 20 million additional children, and this means that all Americans ages 6 months and older are now eligible for the vaccine. So this is significant, an additional 20 million people. Now, I believe that only about 70% of the entire nation's population are immunized. And that is not enough for herd immunity. That is not enough for the disease to begin to go away because enough people are vaccinated that it doesn't have anywhere to go. So this 20 million additional people that are available that should be getting vaccinated is going to help with that overall percentage. And I'm hoping that the parents and the families will embrace this new vaccine and get our children vaccinated. So until next time, remember that your history and your health comes first, and that this is Dr. Brown, and I'll see you around. Thank you.
This has been Your History and Health Comes First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.